There are times when we can feel a burning feeling in the upper abdomen or throat. It can be very annoying, but don't panic. This phenomenon, called heartburn, can depend on various factors, not necessarily serious. Let's discover them together with today's video. Hello and welcome back to Med for Care. Today's topic is the pyrosis. Do you know that burning feeling in your upper abdomen or throat? Well, that's heartburn, commonly known as stomach acidity. But what is causing this feeling? The acid that flows from the stomach back up to the esophagus. Is heartburn really that common? It is a common symptom of diseases such as the gastroesophageal reflux and peptic ulcer disease. It occurs mostly in adults. It is important to know that occasional heartburn is very frequent, but be careful. In 10 to 20% of the population, heartburn is chronic. Do you know what causes heartburn? Bad eating habits, such as eating large amounts of food or fatty food. Eating late at night. Sleeping immediately after eating. Obesity, because excess fat presses on the stomach and causes reflux. Alcohol, because it irritates the esophagus and increases the production of acid in the stomach. Smoking, because it weakens the diaphragm and causes reflux. But there are other causes. Gastroesophageal reflux. As we have seen, the acidic contents of the stomach flow back into the esophagus and cause heartburn. Use of drugs such as non-steroidal anti-inflammatory drugs and some antibiotics, which can irritate the esophagus and cause heartburn. Pregnancy. In fact, progesterone, just like smoking, weakens the diaphragm. How do we recognize heartburn? Heartburn, chest pain, acid regurgitation, chronic cough, difficulty swallowing, nausea, dysphonia. Can our habits aggravate these symptoms? Here I am. Smoking, alcohol, caffeine are all faithful allies of heartburn. But now let's see in detail how heartburn is diagnosed and how it can be treated. Who can evaluate and diagnose heartburn? A fortune teller? Your trusted bartender? A truffle dog? No. You should contact your family doctor or a specialist in gastroenterology. These professionals lead the diagnosis by dividing it into 3 parts. First part, anamnesis. Anamnesis is nothing more than a series of questions asked by the doctor to gather information. What is the duration, frequency and intensity of heartburn? And where is this burning located? What are the precipitating factors? Let me explain. Have you noticed if there is anything that worsens or improves your symptoms? Are there any other family members who have suffered from heartburn or other gastrointestinal conditions? Do you eat healthy? What about smoking and alcohol? Do you do physical activity? Sleep well? Do you think you are stressed? It is also important for your doctor to know if you are taking any medications or have any pre-existing medical conditions, such as gastritis or peptic ulcer disease. Part 2. Physical examination. We listen to the heart and lungs and examine the abdomen. Third part, instrumental examinations. Your doctor may request some additional tests such as EGDS, a procedure which uses a flexible tube equipped with a camera to view the inside of the stomach and esophagus. Ultrasound or X-ray. Esophageal pH metry, a test that measures the pH, acid-alkaline, in the esophagus to understand if there is acid reflux. Esophageal manometry, a test that measures the pressure inside the esophagus. Breath test, which measures the amount of bacteria in the stomach called Helicobacter pylori. Can you believe that these strangely named bacteria are one of the most common causes of chronic gastritis and peptic ulcer? Okay, now we have the diagnosis, but how can we treat our heartburn? Do I pretend to ignore her until it gets bored and goes away by itself? Can I invite it to dinner? Do I change the house door lock to prevent it from entering? No. There are various treatments depending on the severity. Of course, the drugs. I can be antacid drugs like sodium bicarbonate, calcium carbonate, alginates, magnesium. Or they can be drugs called proton pump inhibitors, which prevent the production of acid in the stomach. Just be careful because long-term use can increase the risk of side effects, such as diarrhea or constipation. Together with these drugs, the doctor could also prescribe antibiotics to fight the famous Helicobacter bacteria pylori. Yes, that's him. Ring a bell? Attention. Medicines are important, but our lifestyle is just as important. Some lifestyle changes can help us a lot. Don't panic, it doesn't take much. Let's eat light foods and have frequent small meals instead of big binges. Let's avoid fatty foods, spices, fried foods and alcohol as much as possible. After eating, we wait at least a couple of hours before going to bed. We maintain an adequate weight. No smoking, please. Medicines combined with a healthy lifestyle are the optimal treatment for recovery. Sometimes, though, that's not enough. In some cases, severe heartburn can be treated with surgery. The two main types of intervention are the fundoplication, an intervention that consists in the creation of a new artificial lower esophageal sphincter, endoscopic resection of precancerous lesions. Let's say right away that this surgery is a safe and much less invasive procedure than open surgery and guarantees a faster recovery with fewer complications. Let's see what it is in detail. There is a possibility that the esophagus changes the structure of its lining cells, transforming them from an esophageal to an intestinal type. This process causes them to transform into neoplasms. Precisely for this reason, when they are rather bulky, it is advisable to remove them. To learn more about the topic in our portal, click on the link in the description. We are now at the end of today's video. We hope you enjoyed it. If you found it useful, please support us with a nice like. Subscribe to the channel and click on the bell to be notified every time our new video comes out. See you soon on MED4 Care.